I need you to stop before your next doctor's appointment. Not because your doctor is wrong, not because medicine is the enemy, but because there is something your doctor is almost certainly not telling you. And after 60, what they do not tell you can hurt you far more than what they find. I spent years watching men walk into routine screenings completely healthy and walk out of the follow-up procedures permanently changed. Not because they were sick, because nobody told them that after 60, the math on certain medical tests flips completely. The risk of what happens after the test becomes greater than the risk of the condition the test was looking for. Today, I am giving you 5 medical screenings that could be triggering a chain of interventions more dangerous than the disease itself, and 4 questions that will completely transform every medical conversation you have from this day forward. But first, I need something from you right now. Drop your age, your current weight, and your height in the comments below this video, right now before we go any further. Because at the end of this video, I am going to tell you exactly how to use what you just learned based on your specific numbers. And every man who posts before the video ends is going to get a personalized framework they can take directly into their next appointment. Post your numbers now, then stay with me. This is the most important health video you will watch this year. Before the 5 tests, you need to understand one concept that changes everything. It is called the Cascade effect. A routine screening finds something, a spot, a shadow, a slightly elevated number. Now your doctor has to investigate. More tests, a biopsy. The biopsy finds something. Now you are looking at surgery, chemotherapy, radiation. And each step carries its own risk. Infection, bleeding, anesthesia complications, cognitive decline that never fully reverses. Here is what nobody tells you. After 60, many of the conditions these screenings detect would never have caused you a single symptom in your lifetime. They would have stayed dormant. You would have lived your full life and never known they were there. One simple test, a chain of interventions, more damage than the condition would ever have caused. That is the Cascade effect. Now here are the 5 tests that trigger it most dangerously in men over 60. Number 5, routine colonoscopy after 75. The U.S. Preventive Services Task Force explicitly recommends against routine colonoscopy screening for adults over 75 who have been previously screened. Yet millions are still getting them every year. Full bowel preparation causes severe dehydration in older adults. The procedure carries a perforation risk of 1 in 1,000. And a bowel perforation in a man over 75 means emergency surgery, ICU admission, and a mortality rate of 25 to 30%. If your previous colonoscopies were clean, ask your doctor directly whether continued screening is actually necessary for your specific situation. Number 4. Aggressive PSA testing and cancer screening. For men over 70, the PSA test carries a false positive rate of nearly 80%. 8 out of 10 men who get a high result do not have clinically significant cancer, but they get biopsied anyway. Prostate biopsies cause infections in up to 5% of cases. And for the cancers that are found, the majority are slow-growing tumors that would never have caused symptoms. Treating them with surgery or radiation causes incontinence, hormonal destruction, and a catastrophic decline in quality of life. Before you agree to any cancer screening, ask your doctor this question. If this test finds something, what would the treatment actually look like for a man my age? And is that treatment likely to extend my life or reduce it? Number 3. Routine cardiac stress testing. False positive rates in asymptomatic men over 70 exceed 30%. A false positive sends you to a cardiac catheterization, a tube threaded through your arteries to your heart. Complications include arterial damage, stroke, heart attack, and kidney failure from contrast dye. If you have no chest pain, no shortness of breath, no dizziness, ask why this test is being ordered. Symptoms change everything. No symptoms means the test may be creating the very problem it is looking for. Number 2, routine bone density scans. For men over 75, these scans almost always show bone loss, because bone loss is a normal part of aging. The problem is what follows the diagnosis. Bisphosphonate medications linked to esophageal damage, jaw necrosis, and paradoxically, an increased risk of unusual fractures in the very bone they are supposed to protect. The single most effective intervention for preventing falls and fractures in men over 60 is not a medication. It is resistance training, balance work, removing trip hazards, and optimizing vitamin D. Everything the Apex athlete system is already built around. Number 1, and this is the one that concerns me most. Carotid artery ultrasound screening. A blockage is found. You are referred to a vascular surgeon. The surgeon recommends a carotid endarterectomy, surgery to remove plaque from the artery supplying blood to your brain. In men over 75, this surgery carries a stroke risk of 3 to 5%. The procedure designed to prevent a stroke can cause one. The landmark ACST trial confirmed that in asymptomatic patients, the surgical risks essentially cancelled out any benefit entirely. If you have no symptoms, no mini-strokes, no vision changes, no dizziness, a carotid screening may lead you down a path that ends worse than where it started. Now here are the 4 questions you take into every medical appointment from today forward. 1. What happens if I do not have this test? 2. If the test finds something, what does treatment look like for a man my age and health status? 3. What are the risks of the follow-up procedures, not just the test itself? 4. Is watchful waiting a reasonable alternative? These 4 questions will completely change the dynamic of every medical conversation you have. You stop being a passive patient and start being an informed one. Now go back to the comment you posted at the start of this video. Your age, your weight, your height. Those 3 numbers determine exactly which of these 5 tests are most relevant to your specific situation right now. And they determine which protective habits should be non-negotiable in your daily life starting today. Read the replies under your comment, because I will be there. This is Apex Athlete. We do not just build stronger bodies, we build men who understand their biology well enough to protect everything they have built. If this video gave you something your doctor has not, share it with one man over 60 who needs to hear it before his next appointment. And if you are not subscribed yet, here is what you are walking away from every single week. Precision health and performance intelligence built specifically for men over 60 who refuse to let the system make decisions for them. Hit subscribe, turn on the bell, and join the men who have decided that being informed is just as important as being strong. I will see you in the next one.